Nigeria's Minister of State for Health, Dr. Tunji Alausa, says that the federal government has banned leave of absence for health professionals relocating abroad. Health workers going abroad to seek greener pastures must henceforth resign their appointment before embarking on such journeys. The minister said the directive was contained in the executive order issued by President Bola Tinubu and emphasized that it was done to combat the challenge of brain drain, fondly called the Japa Syndrome, confronting the health sector.
According to him, the annual enrollment of nurses, which used to be about 28,000, had been increased to 68,000, adding that by the end of the year, it would have gone up to 120,000. The president has also ordered massive recruitment of personnel to bridge the gap of the shortage of manpower in the health sector. Joining us this morning to discuss this is the Director General, West African Institute of Public Health, Abuja, Dr. Francis Ohanyido. Good morning, sir. Thank you very much for joining us.
Good morning. It's a pleasure to be on the
All right. We would like to find out what your thoughts are on this move by the federal government. Is this something that maybe, is this a perfect time? Is it a great move? And is the timing right for this move as well?
Okay. Thank you very much. Let me first start by saying Nigeria is in dire straits at the moment, and certain decisions have to be made, but we need to also make those decisions carefully, and they must be stakeholder driven. When decisions are made in such a way that they appear to be gaps between the stakeholders and the stewards of the system, then there may be challenges. Yes, the government is in a place where it needs to begin to stem the tide of Japa Syndrome, as you call it, in terms of healthcare workers, migration out of Nigeria to other places, call it greener pastures, or places where they get better sense of self-actualization of what they think their medical practice is going to be like. But the thing is this, we need to ask ourselves what are the reasons why people leave. Fundamentally, I think the first thing to note that why people leave is because they want to, like you say, self-actualize, get a better life for their families and all that, So, but if they're in employment of the government, so it may be a bit frustrating for government to know that its citizens are leaving while they are still answering that they are staff of the government. That's understandable. On the other hand, people also leave for extended leave, what you call leave of absence, because of studies. And one of the things that happens with that is that they are bringing more skills or better skills to the health system of Nigeria. So this is something that the government needs to weigh very well. Although some people have abused it, in the sense that they've abused the extended leave from the leave of absence thing in some dimensions where they just use it, keep their names on the roll of government and leave permanently without even saying bye-bye in any form. So that itself is an abuse of that practice. But in itself, it's a practice that is important for skills acquisition and also for technical know-how for the system of Nigeria. So the government needs to sit back. While it's going to implement this, it needs to begin to think about how it can get the benefit of stakeholder input into it in a way that is wholesome and does not create observations that will be raised at the International Labour Organization. Because this is very important, because this issue can also be played into the realm of even burnout, mental health, and also the issues of human rights. So government needs to be very careful as it implements this policy moving forward. It needs to be stakeholder driven so that it doesn't find a situation where Nigeria is in front of the International Labour Organization defending some of the observations made on this issue.
Dr. Ohanyido, well, in one of the comments made by the minister, he did say this, and I quote, "It is a free world, but you cannot eat your cake and have it. If you're going to just resign your appointment with the federal government rather than applying for a leave of absence." So it seems that this is coming from a back heel of seeing a lot of doctors that have jackpot, permit us to use that word in this context, and have done this on the pretext of, oh, I need to take a leave of absence. So the government is simply saying, if you need to go, you can go, but you will no longer do this. You've said that they need to be very careful if they're trying to implement this. But my question in all of this is, how careful can they get? Do you think this will stop the health or medical practitioners from leaving the shores of Nigeria?
Okay, So thank you very much for bringing that. I agree with the minister. You can't, Dr. Alausa said it right. You can't have your cake. You can't eat you can't have your cake and eat. How do you say? You can't eat your cake and have it.
Have it, yes.
Yeah, which is very, very important because that's why I said some people have abused it. The original idea behind it was to strengthen the idea of global South development in terms of the South getting the benefit of the know-how of the North. So people go abroad while they are serving the ministry or working in government hospitals or facilities to be able to acquire more skills and more knowledge. But people have abused that. What the government needs to do is actually to put in place mechanisms that tracks and monitors this movement and how some of these recruiters get into the Nigerian system and see that, okay, even if they are going, there has to be a mechanism where government is acknowledged in this scheme of things. Because if you really think of it, a lot of us that went to school in Nigeria, especially in public setting, got trained. We almost got that education for freely. If you think about it, some of us that went to school in government settings and all that, you find out in government schools, our education was quite cheap. So we have to be concerned about this migration. But like he said, I agree with him too, that it's a free world. But implementing this in itself has some ramifications on the health system in terms of quality of care. It has ramifications in terms of even sense of self-actualization within that system. If you're working there, you can feel frustrated that you don't have the opportunity to go abroad, and then you're wanting to work for government. You ask yourself, why would I want to keep working for government if I can't even go and develop my skills elsewhere? So government needs to have this as a stakeholder-driven this, and it should not seem to be targeted at a particular profession or professional group. It should be seen to be something that is holistic, because people are living from tech. The banking sector is suffering because of tech migration. People are living from other industries, so it's not only health. So if you are going to do this, let it be holistic, let it be seen to be stakeholder-driven, and let there be certain what we call it, signposts within the system and guardrails around it that helps make the people who work within the system to understand that you are doing it for the benefit of the system, not just trying to implement a strict workplace policy in the country. That is what I'm saying. So I basically agree with him that things need to be done. That's why I started by saying that we're in a dire state now in Nigeria, both economically, both in living migration, in terms of our best brains are living. We need to be very careful how we go about putting policies in place. That's the main point.
Okay.
And whatever policy we put needs to be stakeholder driven. Very important.
All right. Thank you so much, Dr. Francis Ohanyido. I mean, we just wanted to hear your points concerning this particular situation. And we do hear that there would also be a process that would need to be taken in order for this to be implemented. Hopefully, when we call you, you'll be more than willing to join us once again. Thank you so much for being here.
Thank you very much. It's a pleasure.
All right. Let's take that break. When we come back, it's Which Way, Nigeria?